Osteoarthritis, often referred to as wear and tear arthritis, is the most common form of arthritis in the United States.
Rejuvenate Health on Hilton Head Island treats a lot of osteoarthritis cases. Here to tell us about some of their more common treatments, Dr. Dekel and Dr. Bradley Morris of Rejuvenate Health. Good morning.
Hey, how are you?
Good morning. How are you?
And this has to do with joints mostly, osteoarthritis?
It does. It does.
Okay.
So when we're born, our bodies come out and everything's perfect, and we get a certain amount of cartilage. And as we age, we put more wear and tear on that cartilage, and unfortunately, it's not repairing itself. So once we got our first set of cartilage in all of our joints, that's all we get. And the thing about today is we're starting to live longer. Right. And what's taught us about living longer is now we're starting to wear out the joints. And that's what the osteoarthritis is. It's that deterioration of that joint.
What is the typical age of someone who starts developing this condition?
It really varies. You can, if you have a trauma, you can develop it early, but usually in the 40s, 50s, especially if we gain weight, as we're getting older, hormone changes, etc., and inflammation. Inflammation is a big item that affects the joints in a very big way.
Last time you were here, we were fascinated by the conversation about stem cell therapy. Is that something you can use for osteo as well?
Absolutely. So there's a lot of different treatments for the deterioration of the joint. One is people are getting cortisone shots, which does help with the pain sometimes, but unfortunately it does degenerate the bone further. The second option that's been out there is joint replacement. Now, it's really painful and invasive, and you can't undo joint replacement. So with the advent of stem cells has been wonderful, because now we can actually give an injection into the joint, and those stem cells will actually repair that degenerated joint. So it's going to repair the cartilage, it's going to repair the bone, the ligament, the nerve, any damage that could be done in that joint.
Is this type of treatment something you have to do over a period of time, or how long does it generally take before you start seeing the results and the pain kind of to go down?
I'll give you a recent example. We have one of our patients came to us with totally immobilized shoulder, could not move. He was able to lift his arm within 5 weeks. Okay, so we get excellent results. Usually, as 80% get incredible results after the first injection. Sometimes we have to repeat it, but the results are pretty incredible considering the fact that we're preventing surgery.
Yeah. That's what I was going to ask you. Sometimes you have to repeat replacement surgery as well. Yeah. How frequently do you have to repeat the stem cells therapy?
Well, it's really going to depend on how severe the damage in the joint is, right? So we'll evaluate that and let people know, hey, listen, this isn't going to be a one-and-done thing. If the arthritis is relatively mild, it's really one injection. So with surgery, you have a long downtime and a lot of rehab. Well, with stem cells, we're not going to say, okay, get the injection and you're out playing tennis again. Sure. But allow the stem cells to get in there and actually repair. So it's not really downtime, because we don't want you to be sedentary. We want you to get out there and move and stretch the muscles and get them stronger. Because a lot of times what happens is, because it hurts, people aren't doing anything, so they're not moving. So now the muscle gets weaker, it gets shorter, and then they get the stem cells, and they're like, well, I still have pain. I'm like, well, there's more to do. Sure. So there is some rehab to come along with that. But the great thing about it is, after the stem cell injection, we see the pain dissipate quite quickly. Oh, yeah. And then once the pain's disappeared, now we can get after it, right? So now you can start doing the rehab. You can begin walking again, or you can begin, using your arm again, and stretch those muscles out and get your life back. And
it's done on an outpatient basis?
Yes, absolutely. And it's non-invasive. It's one injection that it's not painful, and patients tolerate it extremely well, and they go about their business.
Yeah, that's fascinating. How can folks get in touch with Rejuvenate? As you said, a lot of folks out there dealing with aches and pains in the joints. And
absolutely. You can call us at 843-757-7836. You can look us up on the internet at rejuvenatehhi.com.
Gentlemen, thank you so much.
Yeah.
Take care.
Thank you.
A day in the park.